The purpose of this webinar is to introduce the operative standards for cancer surgery, surgical standards, and to describe the rationale for the incorporation of these technical standards into the new requirements for Commission on Cancer accreditation. The operative standards for cancer surgery manuals were created to inform best practice for the technical conduct of cancer operations. Volume 1 of the Operative Standards for Cancer Surgery Manual was published in 2015, and it provides technical standards for the conduct of breast, pancreas, colon, and lung operations. Volume 2, published in 2018, provides standards for esophageal, stomach, rectum, thyroid, and melanoma operations. Volume 3, which is currently in development, provides standards for adrenal, hepatobiliary, peritoneum, sarcoma, and neuroendocrine operations. Volume 4, also in development, provides standards for pediatric cancer operations. It is anticipated that future updates to these manuals will keep the standards relevant and reflective of advances in the fields. Each standard described in the Operative Standards for Cancer Surgery manuals describes the conduct of a single, oncologically critical step of a cancer operation in a manner perceived to maximize postoperative outcome. Each standard was generated following the conduct of a thorough analysis of available literature by a diverse panel of surgeons and other stakeholders. Each standard includes a technical recommendation, a statement summarizing the quality of the data upon which the recommendation was based, and a statement of the strength of the recommendation. In the manuals, each standard also includes a thorough discussion describing its rationale and the manner in which it should be performed. An example of the operative standards for melanoma is depicted here. This specific standard describes the width of the surgical margin that should be obtained at a potentially curative wide local excision operation. Data is accumulating that adherence to the operative standards as described in these manuals is indeed associated with improved oncologic outcomes. This slide demonstrates a recent study in which patients with breast cancer were retrospectively stratified by whether or not their operation was conducted in a manner consistent with the operative standards. In each subgroup evaluated, patients whose operation was adherent to the described standards lived significantly longer than patients whose operation was not adherent to these standards. In a similar study of patients with gastric cancer, patients whose operation was adherent to the operative described standards lived significantly longer than patients whose operation did not adhere to the standards. Together, these data suggest that adherence to the operative standards described in the Operative Standards for Cancer Surgery manuals is indeed associated with improved postoperative outcome. 6 operative standards have been included in the new standards for Commission on Cancer accreditation. The 6 standards selected for inclusion in COC accreditation standards are shown here. These standards describe aspects of the conduct of sentinel lymph node biopsy and axillary lymph node dissection for breast cancer, wide local excision of melanoma, colectomy for colon cancer, and rectal resection for rectal cancer, as well as pneumonectomy for lung cancer. The standard for primary cutaneous melanoma, wide local excision, is illustrated here. The standard describes the minimum margin width that is required for melanoma wide local excision based on the thickness of the invasive melanoma. The standard also describes the mandatory depth of excision. Adherence to these standards will be monitored using data collected from primary, operative, or pathology reports. For the melanoma standard, adherence will be assessed using the primary operative report. Use of synoptic operative reporting will facilitate monitoring. Synoptic tools are currently being developed and will be circulated to COC member institutions for this purpose. Other education and documentation tools are currently in development. The 2020 standards for COC accreditation go into effect on January 1, 2020. However, all of these surgical standards will be phased in, and compliance with each of these standards is not expected this year. These standards will not be rated during 2021 site visits. Adherence to the surgical standards will be monitored throughout the year to determine feasible timelines for full implementation. A full timeline for full implementation will be announced as soon as possible.